Let's stay with health stories, as we understand that the United States Agency for International Development has called for increased testing and diagnosis of tuberculosis in Nigeria with the recent donation of a tuberculosis facility and diagnostic equipment to a community in Lagos. This initiative aims to bridge the gap of private sector involvement in government-led public health sector programs in need of immediate intervention. Adesewa Odusoga reports.
Nigeria has the highest rate of tuberculosis infection in Africa. Every year, around 245,000 Nigerians die from tuberculosis and about 590,000 new cases are recorded, with more than 300,000 cases left undiagnosed. Lagos State is the epicenter of tuberculosis in Nigeria, accounting for 11% of Nigeria's burden. To help address this, a directly observed treatment short-course center to the Akinyele Primary Health Care Center in Mosan-Okunla Local Community Development Area was recently handed over to Lagos State. The center, which was donated by the USAID in partnership with non-governmental bodies like the Abdul Samad Rabiu Africa Initiative, is expected to facilitate increased testing, diagnosis and treatment in the immediate community.
The treatment in Nigeria is free for TB, so we want to appreciate the government of Nigeria for their commitment. So we work in partnership with the Global Fund and USAID and the government of Nigeria, particularly the National Tuberculosis and Leprosy Control Program, to ensure that treatment is free for those that are identified with TB diagnosis. So all across the renovated DOT centers, they can be immediately put on treatment. There's no need for any patient to be worried about their full comprehensive care for the TB infection.
USAID provides us with a very capable partner. They've been intervening and supporting HIV and TB interventions in Nigeria for very many years, almost 2 decades. So they have all the data. They know where exactly the gaps are. And they were able to provide us with the information on those gaps, and so we could fill them.
For residents here, this initiative brings them a step closer to being a community free of diseases like tuberculosis, which often raise fears and stigmatization against victims.
Well, this is an avenue for us now to do advocacy. We need to have an advocacy within our local government, telling them why they need to come and screen here. I'm delighted that this kind of a program and facility is within my local government, because our TB is a killer disease that so many people are ignorant of it, because if you don't get screened, you won't know.
The newly renovated Tuberculosis and Diagnostic Center contains TB machines to communities with low resources like this one, where it's truly needed. Adesewa Odusoga reporting for News Central.